So we're going to look at how to document the stent insertion and removal for a kidney transplant patient. So when you're completing the transplant record, you will already have selected that you're undertaking a kidney transplant or a simultaneous kidney pancreas transplant, and you'll see on the kidney information tab that there is a box to say whether you've inserted a JJ stent or not. For most of our patients, we do put a stent in, so we will click insert, and you'll see a pop-up that reminds you that you need to complete the stent registry once you finish completing the transplant record. If you click the little blue arrow, that will close the pop-up. You can finish completing the transplant record and save as normal. When you refresh the patient record in Speciality View, you'll see the details of the transplant that you just created. And for the first 2 weeks after the transplant, if no stent registry form has been completed, you will see a pop-up warning reminding you that this task is overdue. You can see here that the message reminds you that you need to complete the Ureteric stent information form. If you click OK, you'll see that there's a button appeared at the top of the transplant record which says Ureteric stent registry form, and if you click on that, another power form will pull up for you to be able to document your stent insertion. It's a fairly straightforward form. You just need to enter the details of the consultant in charge of the transplant. If the operating surgeon is different to the responsible consultant, you'll need to complete that box as well. Select the speciality as transplant. You can click no for the referral to urology because we manage our own stents in transplant. And then you've got to document the laterality. To keep this simple, this form, of course, is shared with the urologists who use this for stent insertions as well. If you do a left iliac fossa implant, click left. If you do a right iliac fossa implant, click right. For cases where you've got dual ureters to implant, if you select bilateral, then you'll be able to record the left and right stents separately for the 2 different stent insertions for bilateral, and that's a good way of just tracking that there are 2 stents inserted. In this case, we'll pretend we did a right iliac fossa implant with a single stent, and you'll see that a little asterisk appears next to the right stent tab on the left-hand side. When we select that, we can document that we've inserted a stent. We'll put the serial number for the stent in the box, size of the stent and the length, which the theatre staff will be able to tell you. Reason for insertion is transplant, and our default is to remove the stent 4 weeks following transplantation. The next planned action for a simple transplant will always be that the stent will be removed at 4 weeks. The date of the intervention, if you just press T for today and N for now, that'll put the current date and time in the box for you. Click the green arrow at the top, and that will have completed. When you refresh, you'll see that the reminder pop-up has now disappeared, and the stent registry button has now disappeared because you've completed the task. If you want to track at any point whether a patient has still got a stent in, you can scroll down the list on the left-hand side to the Ureteric stent registry, and you'll see here this patient has got a right ureteric stent inserted, and the next planned intervention is to remove it, and the date that that removal is planned is shown. To view the tracking board for the Ureteric stent registry, you simply need to go to the View menu and select Ureteric stent tracking. This will bring up a full list of all the patients across the trust that have Ureteric stent registry records in their EPR record. On this page, you can search patients by MRN or by name, and you can also filter by speciality. By default, the tracking board will order patients by the next intervention date. So those patients with upcoming or overdue intervention dates will appear at the top of the list. And where an intervention is overdue, so for example here, this intervention for this test patient was due in 2020, that will appear in red. You'll also see details of the stents that have been inserted and who's responsible for the patient. The administrative buttons on the right hand side can be used by the admin team for preoperative assessment and tracking. So the next intervention that this patient will have will be to remove the stent in wide mouth patients. And so when the patient comes in on the day of the procedure, all we need to do is go back to the speciality view, scroll down to the Ureteric Stent registry, and simply click open a new stent registry form. So we complete a brand new form every time we undertake an action on a stent. Okay, just make a note of which side the stent was inserted. In this case, it's the right hand side. We click open a new form. The operating surgeon, which will be the registrar doing the stent removal list. And we remember that we put the stent in on the right hand side for this patient. Again, we don't need to refer to urology. The right side will then have an asterisk next to it. We click on that and we say, today we've removed the stent. Again, T for today, N for now. And then the reason for removal is post-transplant 4 weeks. And then when we click save and then refresh, scroll back down to the stent registry, we'll see that the stent has now been removed, and that patient will now have fallen off of the stent registry tracking board and will no longer be visible.